Next on Time for Living, keeping your bones healthy. We'll tell you how.
We'll also introduce you to Edith Staten, a 99-year-old woman who's leading the fight against racial prejudice.
And we head to San Francisco and Los Angeles in today's Traveling Around segment. All this and more next on Time for Living. I'm Rex Traylor.
And I'm Janet Jagalian. Welcome to Time for Living.
You know, every week we present stories and features of interest to older Americans. Now, if you're over 50, this is your show.
We'll be offering information to help you stretch your money and your mind. We also have suggestions how you can stay healthy in your later years.
Staying healthy is the focus of today's show, specifically keeping your bones healthy. As Time for Living's Barbara Bruthian found out, a combination of exercise, diet, and preventative medicine can keep your bones in tip-top shape.
Inhale, please, and it's 1, 2, 3 down, and 1, 2, 3 up. Back straight. 2, 2.
Evelyn Johnston has been exercising at the YWCA in Boston for 2 years. Since taking the senior strength training class, the 80-plus-year-old woman says her bones are much stronger, and she likes the difference it's made.
I feel that my general structure and my posture is very much better, and I feel that I'm much more flexible, that I have much more control of my muscles, that I can now run for the subway, as I did this morning, and not be out of breath.
To avoid fractures, especially as you age, exercise is important. One of the best kinds of exercises for healthy bones is resistance training. That's weightlifting and strength training.
Lifting weights, any weight, increases bone density. The inside of the bones, as you know, are porous. And as these weights, this pressure is put upon the bones, it forces them to make new tissue. So any weight that you lift is going to help.
Women taking the strength training class are reaping the benefits.
I had a very weak ankle that used to give out on me a lot, and now I have no problems with it.
Since I've been doing the weights, I find I can carry 4 bags of groceries without any problem up 3 flights of stairs.
There are a number of reasons why these women have signed up for the exercise class. Instructor Laura White understands what mature women need and want.
The areas of the body that a woman 55 or 60 wants targeted are not the same as a woman 25. 25, we're still wanting to look beautiful and look great in a bikini. By the time we're 55, 60, 65, like me, we want to be functional. We want to maintain our physical independence.
Exercise is just one way to keep your bones healthy. Today, there are 20 million Americans with documented fractures caused by osteoporosis.
Osteoporosis is a silent disease, which means that we often don't know if we have it until we fracture.
So how do you know you're at risk? And how do you find out how dense your bones are? Dr. Susan Greenspan says there's a test.
There are several types of equipment out there that can measure bone density, but currently now the one that is used the most is something called dual energy X-ray absorptiometry. But it is a very low dose radiation. It's equivalent to a plane flight from Boston to San Francisco.
It's important to discuss a bone density test with your physician. Although the exam costs about $200, it's covered by Medicare and most insurance plans. But what if the test discovers that you've lost bone mass already? Can you rebuild your bones?
There are a group of medications that can do this, and currently one of them has been approved. They're called anti-resorptive therapy, meaning that they mainly prevent bone loss. However, what has been found in the studies that have been done is that the bone density or bone mass actually does increase. We don't fully understand why, but it's not just preventing bone loss. We actually do see the bone density go up.
So the good news is there are things you and your doctor can do to slow down and even prevent osteoporosis.
We can make a diagnosis before it happens. And in addition, we know that there are preventive therapies to prevent it from getting worse, and there are treatments. There are now 3 FDA-approved treatments. And it's something that we can take action on ourselves. So it's very important for women and men to become aware of it and to begin to take action now.
Fitness and talking to your doctor are important, but what's also very important is what you eat. And today there are a lot of choices if you want to have calcium, and you should. For instance, this little cup of yogurt, 300 milligrams of calcium. Also, there's orange juice that's fortified with calcium. And here's some cottage cheese, and this has twice the amount of calcium. Milk, of course, is always a good source of calcium. And if you're lactose intolerant, there's even a product that's just right for you. Remember, what you eat is very important for healthy bones.
It's never too late to change your diet, and even if you're 50 years old and your whole life you've eaten devil dogs or the wrong kinds of foods in your opinion, it's never too late to change your diet and to start developing good diet habits. Because like I said, we can certainly slow down the process of the calcium leaching from your bones and possibly even reverse it to some extent.
Nutritionists say that postmenopausal women on estrogen should take 1,000 milligrams of calcium a day, and postmenopausal women not on estrogen should take 1,500 milligrams of calcium a day. How do you translate milligrams of calcium into food?
You can think of it as the rule of 300s. Usually a cup of milk has 300 milligrams of calcium in it. Usually a cup of yogurt has about 300 to 400 milligrams of calcium. 1.5 ounce of cheese has about 300 milligrams of calcium, and about a cup and a half of ice cream has about 300 milligrams of calcium in it as well.
That means you should consume 4 to 5 dairy products a day, and that's too much for most people. Although food is the best way to absorb calcium, many people take calcium carbonate or calcium citrate supplements to augment calcium-rich foods.
What you're looking for on the label is elemental calcium, because the elemental calcium is what your body will be able to use to strengthen your bones. So even though a product or a calcium supplement might say it has 1,000 milligrams of calcium carbonate, maybe only 500 of that will be elemental calcium. So you want to make sure you read that label carefully.
Make no bones about it. Today, growing older is better than ever. With targeted exercises, proper nutrition, and modern medical advances, you can have healthy bones and a healthy attitude. I'm Barbara Brilliant. Time for Living.
I'm pleased to welcome Dr. Herbert Selenkow to Time for Living. Dr. Selenkow is an endocrinologist affiliated with the New England Deaconess Hospital and the Harvard Medical School. Now, in just a few minutes, we'll begin taking your calls to answer any questions that you may have. So if you'd like to join in on the conversation, our number is 617-244-3344. So please pick up the phone and give us a call with your questions and your comments. Welcome, Dr. Selenkow.
Thank you for having me.
I assume you felt the piece that Barbara Brilliant and Dr. Greenspan did was very interesting, and that they certainly emphasized the need for proper nutrition, the whole concept of free weights and exercise and stretching as being a very important part of helping to retard some of the problems with the calcium loss in the bones. But I think that there are other things that we can talk about as well. And I know as an endocrinologist you feel particularly strongly about the need for estrogen.
I certainly agree that lifestyle is a very important factor. However, I'd like to stay with what I know best, that is the medical aspects of this, the treatment, that is medication. Perhaps you want to ask me a few questions about the concerns that women have when they're about to go into the menopause,
right,
and what they should do about their bones and preventive measures for heart attacks.
Well, what they should do about asking their physician, I mean, what is it specifically they need to know? Is it appropriate for them to think about the use of estrogen once they begin the menopause process, or is that too soon?
I think they should be thinking about it when they get to be about 45 years of age. Number one, we all stop drinking milk or drink very little milk and milk products. And even though we should, because it's an excellent form of nutrition and calcium, They really don't. And now, most individuals that I see, I advise when they're in what we call the perimenopausal ages, that is right around the time of the menopause when things begin to change, that they should think about taking at least one calcium tablet in the evening right before they go to bed. And the reason for that is, and everybody always asks why before you go to bed, is because you put out stomach acid, which is hydrochloric acid, after you go to sleep. And hydrochloric acid converts the calcium carbonate to calcium chloride, which is absorbed much better.
All right, so in addition to taking the calcium prior to menopause, when should they likely begin the actual estrogen therapy?
Well, most gynecologists believe that you should take it when your periods stop. The 2-year window between when your menses cease and the 2 years after that is when you lose the most bone. After that, it becomes a very exponentially slow process, but for the 2 years after the cessation of bleeding, of most importance is for women who have a hysterectomy and have their ovaries removed. Let's say they're 35 years old. They can't wait until they would be menopausal. They're menopausal the day after they come down, you know, when they come down from surgery.
Right. Now, what about the type of estrogen? Is there, I mean, I've heard of Premarin certainly. Is that what they begin with?
Well, Premarin is the #1 prescribed medication in the United States. The most prescriptions written are for Premarin. Premarin's easy to take. It's been used for many, many years. It might shock you to know it's obtained from the pregnant mare's urine.
Oh, come on.
That's correct. And it's made just like many other medications are. And it is a wonderful preparation. It's the one I use most of all. Other ones are ethinyl estradiol, which is in the patch.
Yes.
The patch is great if you want to buy it, but it comes off sometimes and it's a pain.
I want to ask about some of the fears that people have of taking this, but there's a call I want to take right now from Terry Lee in Dedham. Go ahead, Terry Lee, you're on Time for Living.
Yes, doctor, I'd like to know if the oyster shell calcium is the right type of calcium to take.
Yes, the right type is the cheapest you can find, which is usually oyster shell calcium. I like to recommend the one that contains vitamin D, about 4 international units in each
that's what
tablet.
I have.
It's a horse pill. You've got to sometimes cut it in half to swallow it because it's very large.
Yes,
and
I know.
it should be taken at night right before you go to bed.
Thank you.
Thank you, Terry Lee. Now, about the fears that some women have, I think they've read about the reports in the New England Journal or in other medical snippets that are in many of the other women's magazines that you're likely to have cancer develop if you start taking estrogen, of the likelihood of breast cancer or uterine cancer. It just increases with it.
This is an extremely controversial subject, and I'm glad you brought it up because I think we ought to try to put it in some perspective. There's nothing we do in life that doesn't have some risk. Just driving your car has a risk.
True.
We don't know what the risk of breast cancer is, but my personal feeling is, from reviewing the literature pretty thoroughly, that if there is a risk, it's from women who already had the small breast cancer, because estrogen is contraindicated in that. But when you put it in perspective of avoiding heart attacks and avoiding broken bones, which in older people can be very life-threatening and certainly debilitating, everything favors taking estrogens if you don't have breast cancer.
What if there's a history of that in your family? Would that also be a risk factor?
It used to be more than now because the data on genetic aspects of that is very tenuous in people at the menopause. Before, in young women, there is some genetic marker and reason for it. After that, which is a common time women get breast cancer after the menopause, I don't think that that's a big issue.
Okay. We'll be answering more questions, and certainly Time for Living is looking for your calls as well for Dr. Herbert Selenkow. So if you have a question for the doctor regarding your healthy bones, give us a call. Our number here at Time for Living is 617-244-3344. Please stay with us. We'll be right back.
It needs to be on these marks.
There.
So, there we go. Let me have a seat
Okay, now I'm okay.
Make sure your mic is...
I'll pull my tie down.
Okay, that looks good, she said.
She's saying it's good?
Yep.
Yeah, it should be because it's...
Okay.
Now, how about this wire? Is that okay?
Just sort of put it under your jacket. And welcome back to Time for a Living. I'm joined today by Dr. Herbert Selenkow, an endocrinologist, and we're talking about healthy bones. You can join in our conversation with your questions and comments by giving us a call at 617-244-3344. Dr. Selenkow, Premarin, that is one of the medications that women begin taking, but then there's a Provera. Now, what does that do to compensate for perhaps some of the problems that a woman might encounter?
Yes. Most gynecologists, when it's possible, would like you to take Premarin and Provera. Remember, that's what's in the contraceptive
From the
pill.
outset?
From the outset. One of the problems, however, is that Provera induces menstruation. Mm-hmm. So that in young individuals who are just going into menopause, we frequently set up a program like you would have on the contraceptive pill, so that when you stop the pill, you have a period. Mm-hmm. At least you know when you're going to have it, and you can deal with it the way women always deal with it. On the other hand, after a few years have gone by and what we call the lining of the uterus, the endometrium, has become atrophied, which is what we really want.
Right.
Then you go on a program of Premarin and Provera every day. And it does come in a single pill, so it makes it easy.
Oh, that makes life a lot more simple, certainly. And we'll take a call now from Mary from Swampscott. You're on Time for Living, Mary.
My doctor recently recommended Fosamax for my bone condition, because I am at risk, along with calcium. Now, my question is, do I really need to take calcium with this?
The answer is absolutely yes.
Mm-hmm.
The Fosamax, like Premarin, although it has a different mechanism of action, stops the bone from losing calcium, or the dissolution of bone, so that the calcium goes out your urine and you get thin bones. The calcium helps to build up bone. It makes the bone stronger and better, and you should take it with some vitamin D, particularly now that all of our dermatologists tell us don't get out in the sun and put on the sunshade and sunscreens. We need the vitamin D, and older individuals need vitamin D even more than younger.
How much, though?
Well, the usual tablet contains about 4 international units, although it does vary. Mm-hmm. I would think that something between 10 and 20 international units a week would be a very reasonable thing, and you can get it over the counter.
So Fosamax plus the calcium with vitamin D is important.
It's recommended to take calcium with the Fosamax. Whether or not you can still take estrogen with it, I think you can, mm-hmm. but the package insert says be a little cautious because they have not used that combination of drugs very long. Fosamax is very new.
Okay.
Thank you.
Mary, good luck. And Lorraine from Quincy is next on Time for Living.
Hello.
Hello, Lorraine.
Hi. I have a question for the doctor. Talk about endocrinology. I had a total hysterectomy as well as a thyroidectomy several years ago. And what's happened in the last 4 or 5 years, I've discovered I have several bone spurs. And I don't know if there's a connection there, but I wonder if the calcium...
Could I ask if the thyroidectomy was for an overactive thyroid?
Yes, I had Graves' disease.
Yes. Well, you see, Graves' disease causes the bones to dissolve even faster than in normal individuals. You turn over the bone, it goes out, and the calcium goes out in the urine.
Right.
So that you would need extra calcium and a little vitamin D more than the other people, but your bones will recover. It's been many years since you had that because we don't use thyroidectomy these days. We use radioiodine.
Right.
Your second part of the question was
the bone spurs.
The bone spurs.
Oh, the bone spurs.
Is the calcium she's taking causing the bone
No,
spurs?
the calcium is not causing the bone spurs.
At all. I don't take
She doesn't take calcium
supplement at all.
Why is that?
Well, until I'm hearing you speak, I never knew that I knew it, that I should have it.
Well, you might ask your doctor about it.
That's correct. I would.
Okay.
Thank you for your call, Janice. Or is that Lorraine? I'm not certain. All right, Janice is next. Janice is in Pittsfield. Go ahead. You're on Time for Living.
Hi.
Hi.
My question is, I've been on the estrogen patch about 9 months now. When I was about 30, I had a blood clot. So this is my concern. Osteoporosis runs very big in my family, so that's mainly why I'm on the patch. I didn't have a lot of side effects from menopause itself. But I also believe that the reason I had the blood clot was because I was on birth control pills and I was not taking them regular.
Blood clots, I presume by blood clot you mean you had phlebitis in the leg and it formed clots there. I hope it didn't go to your lungs or anywhere.
It did.
It did?
Yes, it did.
Well, you have to be very careful, okay? Because estrogen is estrogen is estrogen, whether it's in the contraceptive pill, whether you're pregnant, which makes you more susceptible to blood clots. And you should probably take an aspirin or a half an aspirin every day, you know, which is very preventive of that rather than something stronger. I think you have to sit down and talk about risks and benefits. And I think it's very important that in discussing any medication or any treatment or any surgery, the risks and benefits must be weighed.
Yeah, definitely. Thank you very much for your call. We have several other calls, but I just want to quickly ask you about the use of Premarin or estrogen for helping reduce cholesterol, therefore being helpful in preventing heart attacks.
That is the second major reason to be on estrogen. The first is osteoporosis and preventing breaking your bones, but more importantly, I think, are the cardiovascular consequences. It does, taking estrogen does improve the HDL, you know, the good cholesterol, as opposed to the LDL, which is the bad. And it's extremely important to realize that we have to deal with preventative measures these days, and it's a great preventative measure.
So it's a definite yes.
Yeah. I hate to say this because I know you're going to think that I'm a sexist. However, Mother Nature loves women when they can have babies. After they go through the menopause, they sort of relegate to the position of men and get all the diseases that men get.
I understand. Maddie from Wareham, you're next on Time for Living.
Yes, I'd want to talk to the doctor and ask him a question about estrogen and the losing of your hair.
Losing of your hair and estrogen.
Estrogen.
Is there any relationship?
As far as I know, there is not. Losing hair is very complicated. As a matter of fact, it's very worrisome to women. The kind of losing your hair called shedding, which is what all animals and humans do. If you shampoo your hair and comb it, the hair comes out, is part of the natural cycle of hair. When it gets more severe, okay, there happens to be, unfortunately, very little you can do about it, but it rarely, if ever, that type of shedding causes total hair loss or baldness.
But there is no relationship as far
as I know, there's no relationship.
Okay, thank you for your call. And Amy in Somerville is next on Time for Living. Hi, Amy.
Hi. I've had Graves' disease. I've had 2 of the radioactive iodine drinks, and the phosphate levels have been in the past very high, and the calcium in my bones have been overproducing, and they've been watching the liver too. Does the thyroid cause all this trouble?
Let's see if we can dissect
Sort it
this out
out.
a little bit. Hyperthyroidism or Graves' disease, which you had, is one thing. Remember, I mentioned earlier in the afternoon that it does cause dissolution of bone, but it's correctable by taking calcium and vitamin D. What you're describing of an elevated calcium, and it should be a low phosphorus, is a primary hyperparathyroidism. The parathyroid gland sits next to the thyroid gland, has nothing to do with it. It's the calcium regulating hormone. So that I don't know exactly what you have, but they're two separate things.
It's a little bit difficult to diagnose this way, I understand. Linda from Needham, you're next on Time for Living.
Hi. Hi.
Hi, go ahead.
Okay, I just had a quick question for the doctor.
Sure.
I was just curious about taking such things as estrogen when you're on a regular physical fitness program. Do you think that people that exercise on a regular faithful program really even need to take estrogen? Because especially if you're doing some kind of free weights, it just seems like you're toning and strengthening your muscles there.
Give her the answer you gave
This is an excellent question. Lifestyle benefits are great. If you stop smoking, if you exercise, especially when you're young, and build your bone up, if you don't have too many babies and nurse too many so that you lose calcium in the milk and don't replace it, etc. But the impact of those, I think, is modest compared to the impact of the menopause, where you lose a lot of bone in 2 years.
And the fact that the Premarin, the estrogen, works far more effectively and efficiently than the free
Absolutely.
weights and nutrition.
I think you should do both.
Yeah.
Well, do you think there's really a need for the estrogen if you're exercising on a regular?
Yes.
You still think you need it?
Yes, I think you
The
need it
doctor
if
said
you're
yes.
eligible.
Linda, thank you. I've got to move along. Agnes in Westwood is the next on Time for Living. Go ahead.
Yes, I'm calling about high cholesterol, and I heard you mention taking estrogen along with it.
Yes.
Okay.
Helps to improve the good cholesterol.
Okay, well, I have a 400 cholesterol.
Whoa, that's where I started once.
And I've been taking Mevacor, 20 milligrams a day. For 3 years. It hasn't come down. I have 3 sisters who also have high cholesterol, but I'm the highest.
What's your HDL?
It's way up there.
Well, that's
way
good.
up. That's very
That's very
good.
good.
And you've got to remember that the HDL contributes to raising your cholesterol, gives you a falsely elevated total cholesterol because it contributes to that. Are you from Utah or Quebec?
Unfortunately, she's gone.
Oh, she's gone. Okay,
Yes.
because they have big pockets of familial hypercholesterolemia in those areas.
Well, this subject matter can go on for hours and hours. I hope we've given people a chance to understand that there is an alternative, and that is estrogen therapy to help the osteoporosis problem. Dr. Selenkow, thank you very much.
And thank you
I've
for
enjoyed
having
this
me.
tremendously. Well, if you're looking to downsize your home, you may be asking yourself, how can I possibly fit a house full of belongings into an apartment? The answer is, you can't. In today's Newsbreak segment, Time for Living's Carolyn Murdoch tells us there are services available to help you decide what stays and what goes.
Just by sorting through these things, we should be able to throw out a fair amount of it.
A lifetime of accumulated belongings can be overwhelming even for those with no plans to move. But how do you decide what's treasure and what's trash?
This is from 1981. I think we can probably throw that away.
Shannon McDonald started a professional service to help people decide what stays and what goes.
They make the decision. I think a lot of people are afraid of this process for fear I'm going to bring in a backhoe and clean out the entire house and leave. And that's not the object. The object is for them to achieve whatever it is they want to achieve. And I attempt to help them do that.
One of the first steps is to separate things into categories, then determine what's really necessary. Some items can even be sold for extra cash. This recent widower moved from a house to a 3-room apartment. Still, he has plenty of space. He says he's glad he called Clutter Be Gone before tackling the move himself.
All the boxes were stacked one on the other, and all the furniture was pushed in the corner. It looked to me like it was an insurmountable problem, and I didn't know how to start.
McDonald tells customers there's no amount of clutter she hasn't seen before. In fact, the hardest part of the process can be admitting you need help. I'm Carolyn Murdoch. Time for Living.
What a great idea. Coming up next on Time for Living, our second effort salute. You'll meet Edith Staten, who is a leading one-woman crusade against racism, so please stay with us.
As we do the show, we find more and more older people who are doing some exciting and worthwhile things with their lives.
These people really debunk the myth that when you get older, your useful days are through. Take, for example, Edith Staten, the Cambridge, Massachusetts woman. She's doing her part to educate people about prejudice and racism.
Time for Living's Rod Fritz tells us more about this remarkable woman who is the focus of this week's second effort salute.
I don't know anybody who's older than I am, and I certainly have learned it. I'm 99 and a half, almost 100, and I'm sure that my attitude has changed. And I think the other people too.
Changing attitudes is what Edith Staten is all about. The Cambridge, Massachusetts woman is doing her part to erase racial prejudice from our society. Mrs. Staten invites people into her home to watch a videotape called Healing the Heart of America.
When I have this, show the video, I always try to have a few black members and some white members and possibly some old or some young, or a mixed group of people.
I saw my greatest fear displayed.
The videotape is about how the citizens of Richmond, Virginia have dealt with racial injustices. Mrs. Staten uses it to spark discussion among visitors to her home in the hopes of confronting and overcoming those same injustices.
One businessman, a retiree who saw this video from Richmond, said that he was sure he didn't have any prejudice. But then when a black lawyer won a very tricky case from his corporation, he thought, well, isn't it remarkable that a colored man could do that? And then he suddenly realized how he had expected so little of people of color.
Of the first European settlements in the New World.
But the video isn't the only tool Mrs. Staten uses to battle racism. She uses her century of first-hand experience to help root out prejudice.
I was taken care of as a baby by a middle-aged black woman who was born a slave. And when I was born, my mother had no idea of how to take care of a baby. And so the doctor who took care of her when I was born got a hold of Dee to come in and help her with her baby. And she was the I was crying and fussing and waking up the uncles who were social lawyers and who went out to dinner parties and were out late in the evening and didn't like being waked up early in the morning. And Dee picked me up and put me up on her shoulder and patted me on the back, and I went to sleep. And from then on, she was part of the families.
This question.
Mrs. Staten believes her meetings are having a positive effect.
Well, I don't think there's always a very dramatic change right at the beginning, but I think this businessman who immediately said what he realized that it was race prejudice when he thought that lawyer, it was amazing that he was so bright and he was a black man. But some people do look at the changes that happened to other people in the video and think, well, that's what's happening to me. That I realize how prejudiced I am.
Mrs. Staten only has a few people at a time view the video and take part in the discussion. And while the changes she is evoking may be gradual, they are being made.
Well, I think that from the black person's point of view, it's a very bitter experience to have felt that there was prejudice against them and in jobs and in where they live. And I've had people come in to see this video who say, well, you'll never change this country. It's going to take more than this. But it's already changing.
Thanks in part to the efforts of Mrs. Edith Staten. I'm Rod Fritz. Time for Living.
What an enlightening interview.
That's for sure, for sure. Now, if you know of someone like Mrs. Staten who is worthy of our Second Effort Salute, please tell us about them. Please write to us at Second Effort Salute, care of Time for Living, Post Office Box 1698, Framingham, Massachusetts 01701.
Well, there's a lot more ahead on Time for Living. Up next, our Traveling Around segment brings you to sunny California, so stay right where you are. We'll be right back. about you, Janet, but I could use a vacation.
Well, I'll never disagree with that, for sure. The only trouble is finding the time, of course, to go. It's a good thing we have our Traveling Around segment to satisfy the wanderlust in all of us.
You know, every week we bring you to a new destination, and today is no exception. We're heading west to the Golden State, California, specifically the cities of Los Angeles and San Francisco, California's largest cities. Now, San Francisco is the famed city by the bay, and Los Angeles, the movie capital of the world. We take you there now on today's Traveling Around segment. America has always loved a good Western, but long before today's shoot-'em-ups, there were celluloid heroes like Gene Autry. While in Los Angeles, visit the Gene Autry Western Heritage Museum. The museum contains over 25,000 artifacts tracking the West from prehistoric times to the present. Among the more popular exhibits, the fantasy created by film. The Western genre captured America's imagination from the start.
Everyone had their own hero. If it wasn't Gene or Roy, it would be Hoppy, and if it wasn't Hoppy, it was the Lone Ranger. So there were literally dozens of these sagebrush heroes out there, and everybody wanted to be like them.
Here you'll find lots of movie memorabilia, like Tom Mix's hat and rifle, Gary Cooper's holster. Costumes range from the patriotic Roy Rogers and Dale Evans to the rugged Sundance Kid. Not into Westerns? How about seeing your favorite show being taped? Free tickets are passed out ahead of time at tourist attractions like Mann's Chinese Theater or at Audience's Unlimited booth outside the Fox Studios in Hollywood. But be advised, get to the show early, because depending upon the popularity of the show, there's still a chance you won't get in. That's because the studios give out far more tickets than there are seats to make sure the house is full.
Unfortunately, they do let the tour buses in first, so the chances of you getting in are kind of slim, but you can usually try.
From Los Angeles, we head up the coast to beautiful San Francisco. Take a walk to the Golden Gate Bridge or to Fisherman's Wharf. Here's where you board the cable cars. Fun to ride and still a bargain at $2. They'll take you to Chinatown and the Union Square shopping. A great way to see the city is from the water. Alcatraz tours and bay cruises cost $15. Or you can ride a commuter ferry, get the same view for a whole lot less. Another great way to see the city is to take a film and fiction tour.
Right behind me is the building that Michael Douglas lived in Basic Instinct. In fact, Basic Instinct was filmed throughout all of San Francisco.
The walking tour visits dozens of San Francisco locations Hollywood has made famous, such as Kim Novak's home in the movie Vertigo. You can see the hill Steve McQueen blasted down in the movie Bullet.
When Steve McQueen came down this street going about 115 miles an hour, he came right down this way.
You'll never know what you'll find on this type of walking tour.
San Francisco, open your golden gates.
We've been coming to San Francisco for years, and we've learned more in a few minutes here than we have the entire time we've come. You know, it's really interesting.
Los Angeles and San Francisco, today's Traveling Around destination.
Welcome back to Time for Living. While we've talked about traveling to San Francisco and Los Angeles, Greece and Turkey, and many other worldly locations in our Traveling Around segments, when you're looking for that ultimate destination, preparation is the key to making a trip worthwhile.
That's right. Like anything else in life, doing your research is the key to success. That applies to taking a vacation as well. And this week, Time for Living's financial expert Steve Burke tells you how to get the most for your money when planning that getaway vacation on this week's Health, Finance, and More. Steve?
Thank you. Vacation. Now, there's a word with a ring to it. And one of the nicer things about retirement or approaching retirement is the opportunity to take trips to interesting or even exotic places at a discount. You've heard me say that in retirement, saving money is as important as making it. Strangely, a lot of experienced people don't take advantage of the many cost reductions available to people over 55, 60, or 65, or even 70. You can ski, golf, travel, and stay at resorts, hotels, etc. at deep discounts from the regular prices. And as I've also mentioned, there's a lot of help out there. The first place to check is your travel agency. Let them know what you'd like to do, then ask questions. For example, I'd like to visit the Southwest, Arizona, say. Is there a shoulder season? Most of you know that shoulder season is that time just before or after the regular tourist season. In shoulder seasons, the facilities are the same, the views are pretty much the same, and the weather is okay, but the prices are definitely reduced. Or you might ask the travel agent, airline, train, or bus people if there are reduced fares for traveling at certain times or places. Don't forget the ships, cruise lines, or freighters, which have a limited number of cabins and lower prices. In addition to the better-known approaches, there are organizations which specialize in working with those of us with interests in common, such as archaeology or botany, marine biology or animal behavior, or history, ancient cultures, possibly courses in new surroundings, such as the University of Europe. Two good examples of enjoyment, travel, and adventure while you save money are Earthwatch and Elder Hostel. A brief overview of these two examples of an inexpensive way to see the world. Imagine traveling overseas or to a unique location in the United States to be with a recognized expert in a fascinating discipline such as Egyptology or a study of the behavior of dolphins, and the cost of this adventure is partly deductible. That's a thumbnail sketch of Earthwatch, an organization which matches your interest and talents to research projects all over the world, working with someone daily who is very well informed about the subject, and you're part of the research team. Let me hasten to add, this adventure is not for everyone, but for those of you interested in active participation in the Amazon, the Far East, or the USA, it can be the trip of a lifetime, and a good part of the cost is tax deductible. For a more relaxed approach to exploring, Elder Hostel provides the opportunity to live at colleges and universities and other facilities which are inexpensive. The objective is to learn about the culture, economics, and history of the area you select. Your instructor is someone well acquainted with the area. Your trip includes lectures and sightseeing with people like yourself, those of curious mind and an interest in various parts of the world or USA, with a desire to gain real, first-hand information on the scene. While many of your teachers are college professors, there are no tests, so you can't flunk the course. If you want to participate and maybe be involved in new discoveries, Earthwatch is your target. If a more relaxed academic pace is more to your liking, Elder Hostel should provide a very interesting, inexpensive trip. To contact Elder Hostel, call 617-426-8056 or write to Elder Hostel, 75 Federal Street, Boston, Massachusetts, 02110-1941. For Earthwatch, call 617-926-8200 or write to Earthwatch, Post Office Box 9104, 680 Mount Auburn Street, Watertown, Massachusetts, 02272. Both organizations are nonprofit and dedicated to giving you a lot for your money. Enjoyment at a sensible price. I'm Steve Burke. Time for Living.
That was Steve Burke of Coordinated Financial Planning. Great job, Steve. Now, if you have any questions for Steve, please send them to Health, Finance, and More, care of Time for Living, Post Office Box 1698, Framingham, Massachusetts, 01701 9998.
When Time for Living continues, we'll have a check of our mailbag, so please stay with us.
it's time for our mailbag, but this week, instead of sharing your letters, we have some events coming up that you may want to participate in.
That's right, Rex. If you like to cook, then you'll want to participate in the cooking demonstration and luncheon at the Braintree Council on Aging at 71 Cleveland Avenue, which is happening on April 23rd at 11 a.m. It's $2 per person. For reservations, call 617-848-1963.
Now, if you happen to be feeling down or depressed or think you're depressed, don't worry. You can get a free depression evaluation at the Norwood Hospital Psychiatric Unit. All you have to do is call the Neponset Valley Psychiatric Center for more information. Their number is 617-255-2087.
And if you're willing to work with elders, then you'll want to help the Bridgewater Office of Elder Affairs. Volunteers are needed for community outreach work with elders in the community. Responsibilities include confidentially contacting senior community members by phone for the Elder Affairs Office. Training is provided. Please call 508-697-0929.
Okay, now if you want to dance, sing, or watch others perform, you won't want to miss this celebration. The celebration is of valued aging, community, and wellness at the Franklin Park Zoo in Boston. And that's in Massachusetts, of course, for you folks out of town. On Friday, May 3rd, this event's going to happen at 10 a.m. to 3 p.m. There'll be dancing, steel bands, gospel choirs, theaters, arts, young performers, and guess what? $1 will get you admission and lunch. But your tickets must be purchased in advance. Now, you can call Eldecor at 617-491-2227 for more information.
Grandparents, as parents, can find the help you need to be the best that you can, and that's going to happen on Saturday, April 27th from 9 a.m. to 12:30 p.m. at the Senior Resource Center, 630 Plantation Street in Worcester, Massachusetts. A free lecture is being provided with a $5 donation suggested to cover breakfast. So for information, contact the Age Center at Worcester at 508-755-4388. Well, there's a little something for everybody.
That's for sure. Coming up next on Time for Living, a look ahead to future shows, so don't go away. Well, it's a pleasure to have you join us again this week on Time for Living.
We certainly hope you've enjoyed what you've seen on our show.
Now, in the weeks to come, we'll be telling you about Older Americans Month.
The Secretary of Elder Affairs, Franklin Olivier, will be joining us to tell us what his office will be doing for this exciting time.
We'll also read more of your letters.
So until next week, remember, it's time for living.